Hi, I'm Cindy. I am the owner and one of the speech therapists at Speech for Success.
Hello, I'm Dr. Ella. I'm the lead occupational therapist at Speech for Success.
So today, Ella and I are really wanting to share some important information regarding feeding. We want to reach out to the parents that are having a lot of trouble at meal times and are concerned with their child's feeding. So, Ella, let's hear a little bit about the occupational therapy side and what you do with feeding therapy.
Sure. So for me, OT, we focus on sensory side. So we focus on some of the five senses. For example, the tasting, smelling, and touching. So some kids they may be sensitive to some textures, and they may be sensitive to certain smells or certain tastes. You may see that some kids they're being extreme picky eater. They only eat certain food. Sometimes they only eat the snacks during their meal time. Not actually the real meals, because they don't like certain things like some food with really strong textures, strong smells, or strong flavors. So that's what I focus on in OT is like I help these kids um, to increase their tolerance with like their non-preferred food with like the non-preferred textures, smells, or taste. Another thing I would focus on is their muscle tone. You may see that some of the kids they're sitting like this way. They have like a low muscle tone. They're not able to bring themselves up. They're not able to maintain these postures, or they may be like being floppy, or they may like be moving around, not able to sit still in the chair. So those are the stuff that are related to their muscles strength, their motor skills. Also, that would be the parts that OT can help with, because we need the strength, we need the posture to sit up, to sit in the upright position during the meal time. Can you talk a little bit about how speech therapy can help with feeding as well?
Yeah. So with speech therapy, we look a lot at posture as well because posture affects so much of how we swallow and chew our food. So that's where speech and OT can work really closely together and in many other ways. But usually what happens is when there's a concern with feeding at home and they're looking for a speech therapist, we like to look at anything structurally that's going on with their mouth. So we're looking at tongue tie, lip tie concerns. Were they able to latch as a baby, breastfeed, take a bottle? And if we don't find anything wrong functionally, we like to see, okay, is there something going on medically? If the child might be having pain when they're eating, we might look at reflux, constipation. It's very much a very broad thing that we look at when it comes to feeding, and it's usually an underlying issue. It's not just a child being a picky eater. And so when someone comes in with feeding concerns, we want to rule out any functional concerns, any medical concerns, then we want to jump into why are they having so much trouble. And a lot of the times it is sensory, so that's where speech and OT can work really closely together to see, okay, why are they having such an aversion to certain foods? If you're having any trouble with your child at home with feeding, please come in, get a speech therapy and occupational therapy evaluation so that we can help determine why they're having trouble with feeding and how we can help you on this feeding journey.